Hello, my name's Kasim Javed and I'm a researcher at the University of Oxford, helping run with other researchers the Rudy study. Rudy stands for the Rare and Undiagnosed Diseases Study, and it's a research registry or database that patients have co-produced and is informed by the Patient Forum. I'm now going to describe the benefits for people to take part, whether they're patients or researchers. The primary objective of Rudy is to describe the detailed phenotype of individuals with rare diseases. A detailed phenotype is a description of how the rare disease affects the symptoms, function, complications and treatments for individuals living with the rare disease. Using this information, researchers can then understand whether there are distinct patient subgroups for which we can design specialized tests and also treatments. Our other objectives are to describe the burden of rare diseases on patients' quality of life and other outcomes, as well as the burden and impact on family members. We'll use this to increase our understanding of people with rare diseases, as well as look for genetic basis in some cases. Finally, by being able to describe individuals with rare disease in detail, other researchers can then apply, with patients' consent, to approach them for further sub-studies. The main reason why people join Rudy is for the benefit to research and contribution to our knowledge of rare diseases, as well as the opportunity to get involved with other research studies. However, it's important to understand that any information you give is secure. Any personal information will only be able to be accessed by you and administrators only if they need to. Researchers can only access your anonymized data through ethically approved studies that have been through our Data Access Committee. But we wanted to provide more immediate benefits of taking part in the study. So as a general rule, all the information you put into Rudy is available for you to see either in your timeline or in other parts of the database. And we think by providing these benefits, we'll be able to give encouragement for long-term engagement with the study. So researchers like to take part in the study because it gives them an overview of how people are getting diagnosed, how their disease is progressing, any complications and treatment responses, as well as being able to approach individuals for future studies. Rudy works through an online platform, but if you can't access the internet, we can also provide paper questionnaires. People complete these questionnaires online, and that data is readily available for research. People can also join a very active patient forum we have that directs how Rudy develops. When you join, you have a to-do page offering you two options: information about you and about your rare disease. The information about me really is the main platform that researchers will access, and this involves completion of questionnaires depending on the type of rare disease you have. Some of these questionnaires seem to be repeating questions already asked, and this is because we don't have a specialized questionnaire for that rare disease, so have to use what is available. You can see here the number of questionnaires you submitted in green, started in orange, and are yet to start in blue. You can complete as many as you wish, but the more you complete, the more helpful it is for researchers. Back on the to-do page, you also have a section called About My Rare Disease, and this allows you to package all of your medical history in an easy-to-use format. And here we have a number of forms you can complete if you've ever had surgery, medicines you've had, whether you've broken a bone, and many other features in a growing list of forms. One area you may find helpful is the diagnostic history form, and this allows you to record how you were diagnosed, what other diagnoses you had, and what other healthcare professionals you saw, and will also be used for research, but also for your own personal record. As I've said, you can see all the information that you've inputted either on the forms but also in your timeline page, and you can even download all of the items you have or hide certain features, and this has provided a lot of benefit for some participants in the study. And if you have any questions, you can always get in touch with us either by leaving a message or preferably by emailing us at rudy@ndoms.ox.ac.uk. For more information, do have a look at our animation that one of our participants in the Rudy study has made, as this gives a good overview of the study.